If you're admitted to hospital, it's likely the first face you'll see will be a junior doctor. Some of the NHS's youngest members of staff, shouldering increasing responsibility.
Hi, yes, Dr. Bingham. I've had a really difficult time, I would say. I think I take my work very seriously. It's a really big part of the person that I am. But the last 2 years and the pressures that the whole team have been under have stretched the care that we can provide.
Long shifts and staff shortages are taking their toll. And as we exit the pandemic, the problems aren't easing.
The last year to 6 months, the staff shortages, particularly nursing staff, has been a really big problem. In some ways, that's pulled teams tighter together, but you can see the stress and the cracks starting to show, I think.
Junior doctors should work an average of 48 hours a week, but that's not always the case.
Very often you're doing 12, 13-hour shifts. When you're at the end of those, you find there's a gap, so it's then you covering yes, another shift, for example. And psychologically, it's difficult as well, being there with patients who are really struggling and at the end of life, and trying to be there with them, and then all the extra cruel things that COVID brought with it. You yourself, as well as being the professional there to provide treatment, which is what we're used to, you were there holding their hand and doing that extra part.
It's no surprise then that Scotland's trainees are moving across the world. Michael made the journey to Australia in 2016 after suffering from burnout, and he's not looked back.
They have got the numbers of doctors to cover all the shifts, which makes a huge difference, because when there's the numbers there, people get enough time off. My last year in the NHS was a pretty unhappy time. I wasn't sleeping very well. I was coming home from work and I had headaches from all the stuff that I had to deal with during the day, because there just wasn't enough time in the day. My mental health was really suffering.
The British Medical Association is worried, raising concerns over the number of junior doctors who have reached breaking point.
I don't think I can pick out one person that isn't feeling like that at least some of the time, if not all the time. It wouldn't be surprising to find people crying or upset or just absolutely exhausted. I think the frustrating thing from my perspective is that I'm doing absolutely everything I can to try and fix this, and it sometimes feels like the people that we need to listen aren't listening.
Listening now is the Health Secretary, who says he is committed to growing the workforce.
I think pay terms and conditions, and I say pay and terms and conditions, are really, really important. And I think absolutely, of course, when it comes to working conditions, improving those working conditions and taking care of the wellbeing staff, I think those are 3 critical pillars which will help to hopefully retain and recruit more doctors to our NHS.
These issues were not caused by the pandemic, but they were made worse because of it.
We're all people as well, and that to be able to provide the care that we all want to provide, we need to look after each other and look after the teams that we work in.
The pressure is on junior doctors like never before, but it is also on the NHS and Scottish Government to ensure they are looked after as well as patients. Polly Bartlett, STV News.